welcome or welcome back to my channel. My name is Brianna and I do anatomy and physiology videos and pharmacology videos. Today we're going to be going over the drug phenylephrine. If you like this video, be sure to give it a like, hit the subscribe button, and don't forget to hit the notification bell if you want to be notified anytime I post a video. Also, be sure to comment down below any content you'd like to see on this channel. And without further ado, we're going to jump into today's content. So, for the drug phenylephrine, we're going to be going over brand name, drug class, mechanism of action, therapeutic use, adverse reactions, contraindications, nursing considerations, patient education, interactions, and administration. So this drug phenylephrine does treat a disorder of the respiratory system, upper respiratory system, specifically nasal congestion. So, of course, the generic name, once again, is phenylephrine. The brand name is commonly known as Neosephrine. So, the drug class is a sympathomimetic, which is kind of a mouthful, but this is basically a long, confusing, scary word for a decongestant. So, mechanism of action. This drug is going to mimic the action of the sympathetic nervous system, so remember our fight or flight, by activating alpha-1 adrenergic receptors in the nose. So this is going to cause vasoconstriction of blood vessels in the nose, which is going to cause a shrink of the nasal turbines, and then this is going to open the nasal passageways, and therefore you will have decongestion. And why is this drug used? Once again, it's going to reduce nasal congestion with allergic rhinitis, sinusitis, and the common cold. But do be aware that this drug that has no effect on itching, hives, or it's not acting specifically on the allergic rhinitis itself, only the congestion aspect. So, what are some of the adverse reactions? So you can have central nervous system overstimulation, so kind of the agitation, anxiety, insomnia that you can see when your sympathetic nervous system is activated. And then we have, of course, increased blood pressure, increased heart rate. You can have palpitations and dysrhythmias. And then you can actually have rebound congestion, and this happens when you are overusing this drug. Once you use it too much, your body's going to become used to it, and then the minute it's gone, you're going to become congested again. And that's really only seen with misuse or overuse of this drug. Next, we have contraindications and precautions. So chronic rhinitis, and the reason why we say this is because we don't want you on this drug long term. So if you're experiencing chronic rhinitis long term, you're not going to be using this drug long term because it's unsafe and you can become addicted to it. Another contraindication: narrow angle glaucoma, cardiovascular disease, hypertension, if you have a history of heart palpitations and dysrhythmias, coronary artery disease, and then older adults. And we say this because this drug causes vasoconstriction of vessels in the nose, and older adults already have poor perfusion and typically have poor circulation. So that's one of the reasons why we say older adults are going to be a contraindication. All right, let's jump over here to nursing considerations. So you want to monitor for anxiety, agitation, and insomnia, of course, because a common side effect is those symptoms. And one intervention is administering a mild hypnotic for sleep. So if your patient is experiencing insomnia, be in contact with the provider and potentially get a hypnotic to help them get some sleep. Then we have monitor heart rate, blood pressure, administer drug only as needed. Once again, because you can become easily addicted to this drug. So it's really a PRN kind of supplemental drug. Another thing we can do is recommend nasal glucocorticoid to minimize the symptoms while discontinuing drug after prolonged use. Like I said, probably for the 100th time, you can become addicted to this drug. So discontinuing the drug can be difficult. You can be faced with a lot of rebound nasal congestion. So what a glucocorticoid is going to do is reduce that swelling and hopefully reduce the symptoms of the rebound congestion. Okay, jumping down to patient education in the purple. So, number one, tell the patient to notify the provider of excessive CNS symptoms. So, if they're dealing with a lot of anxiety, agitation, insomnia, be sure to let the provider know. Consult with provider regarding alternative therapy for withdrawal. So, if you're facing withdrawal symptoms, you want to be in coordination with your provider with an alternative drug you could use to combat that. And then we have report prolonged tachycardia and palpitations. And then regularly check blood pressure if you have a history of hypertension. Once again, tell the patient do not use this drug more than 3 to 5 days a week. And then as you're discontinuing the drug, taper it one nostril at a time. And this is going to help with those withdrawal symptoms. All right, and then lastly for our interactions, MAOI antidepressants are going to potentiate the effects of sympathomimetics, so don't give them within 3 weeks of one another. And then we have beta-2 adrenergic agonists and other stimulants may potentiate the hypertensive effects of this drug. So once again, if you have 2 sympathetic nervous system stimulants, you're going to have more severe adverse effects. So you definitely want to stay away from that. And then I forgot to touch on administration. This is a topical nasal spray, so you just put it in the nostrils and spray it that way. Or you can take an oral drug. All right, that is about all I have for phenylephrine. This is video 3 in my 6 video series of upper and lower respiratory drugs. So I'll see you in the next video, and be sure to comment any questions below. Thank you so much for watching.